And joining us now with the latest on COVID-19 is Dr. Lane Rowling, virologist and infectious disease expert. Doc, it's good to see you this evening.
Hey, good evening. It's always good to see you. Super Sunday, Brittany.
Well, Doc, the big question, why are we starting to see such a rise in these cases right now?
Well, the reason why is that we have this new variant mutations in the Delta mutation, the double, triple mutation from India, the triple mutation from India. And then what's happening is that this virus is starting to ramp up and start to be another pandemic. And the reality is that even though we have a vaccination program, the virus is really immune to the vaccination and also the fact that people are just not being compliant. People out there, not wearing masks, people not washing their hands, people not continue to do the biosafety protocols and procedures that they need to do and create their own bubble. This Delta virus is 225% more transmissible than the Alpha strain of the SARS-CoV infection. Also, this virus has the ability to affect you within 5 seconds, and this virus has an incubation period of about 4 days, which is 2 days shorter than the original Alpha strain. So this virus, the Delta strain, is much lethal. It's much more effective. And the bottom line, at the end of the day, this virus, the Delta mutation virus, is driving the new pandemic.
And Doc, health officials are concerned about the Delta variant and the rise in COVID infections. Like you just mentioned, parts of the country are starting to fully reopen to bring back a sense of normalcy. Could we have yet another crisis on our hands?
Oh, absolutely, Brittany. We can see it every day. This is the reality. Everybody needs to understand. We had a preview of what happened last year. 600,000 people died. Morbidity, mortality rates around the world elevated. Certain societies collapsed, economic insecurity, etc. Well, guess what, folks? We're in the second part of that act this year with the Delta mutation. So exactly that's what's happening. You look at states like Arkansas, Tennessee, Mississippi, Florida, California. The cases are going right off the roof. Hospitalization going up. ICU beds are being filled with people with the new Delta strain. And this particular Delta strain, Brittany, is pretty interesting because it's just not affecting older people. It's affecting younger people and adults, etc., even children. I had the opportunity the last 2 days to help take care of 2 COVID patients with the Delta strain. One was 36, the other one was 24, and they were spitting up blood, had the full complements of the symptoms and signs of the Delta. And so this shows you that this virus is picking up steam and will be the driving force for the next year.
And we know that's not the only one to be concerned about. The Lambda variant, which was discovered in Peru last year, is also raising concerns. Scientists say this variant could be resistant to COVID vaccines. Are you concerned that this may turn into the next super spreader like the Delta variant?
Absolutely, Brittany. The Lambda strain out of Peru, they're still trying to figure it out. They're still trying to figure out, how severe it is, but it's driving the infection in South America. And the problem that we have, and I think the audience and everybody that listened to this great news program, you need to understand that these are always mutating, period. We had a case in Belgium where a lady was affected with not just the Alpha strain, but also the Beta strain. So people, you can have a dual infection with 2 different strains. And with this Lambda strain, this could be the next pandemic that's going to drive it next year. That's why we have to have a very effective policies and procedure that is based for everybody. Everybody's going to have to mask up. Everybody's going to have to wash their hands. If you're going to try to do a vaccination program, that vaccination program has to be geared to that specific virus. The vaccines for Pfizer, Johnson & Johnson, and Moderna were made off of the Wuhan strain. You have to make a vaccine for the Delta strain, the Lambda strain, double and triple mutation strain, if we're ever going to get a hold of this virus.
Well, with more than 67% of adults, they've received at least 1 dose of the vaccine. With the rising cases and another variant of concern on the loose, how can officials, or health officials rather, convince those who remain vaccine hesitant to roll up their sleeves? Because we look at who's at risk at getting the sickest, Doc.
Well, I mean, right now, you look at what's happened in LA, Los Angeles, the vast majority of people getting sick there in the hospital beds are being filled with Black people. Same thing in rural Arkansas, Tennessee, Mississippi. The people that were affected initially last year are the ones that are being affected again this year. And that's why, Brittany, your program and platforms like this, we have to be the voice and give people accurate medicine and science information so people can make the best decision. The problem that we had in this initial thing was the politics got in the way. People telling you put your head in the microwave, drink Clorox, bleach, it's going to go away. And you have people that are not scientists, infectious disease guys, all just talking about this disease. So guess what happens? You have a misinformation. You have misdiagnosis. You have people saying wear a mask, don't wear a mask. Folks, it comes down to basic sense, virology. This is a virus airborne. You have to wear a mask, period, end of story. And if you do that and the people have accurate information based off of people that have been trained in this profession, not a politician, because a politician were some of the people that got this virus out of control because you never did a true lockdown. You had people not wearing masks, and now what's happening, what the famous word we like to say in our business is, now you have blowback. And the blowback is that the virus is out. For example, Arkansas, Tennessee, you cannot put that virus back in the bottle, just like Missouri. And so these are the consequences of policies and procedures that were not done right, and people are going to suffer, and people are dying from the consequences of people that did not understand virology.
Yeah, and Doc, unfortunately, it sounds like it's going to be a continuous thing. But you mentioned something to me right before we let you go. You mentioned that next year we could be on tap to having about 1 million people who have died from the virus.
At the rate we're going, Brittany, and this is just straight statistics, and you can do the numbers yourself. At the rate we're going, by January, we're going to be up to that million number mark where 1 million Americans have died from the beginning of the SARS-CoV virus. This time around, it's going to be much more, this part, or what I call part 2, driven by the Delta P mutation, is going to be stronger. You're going to have much more people dying, much more complication, because it's not just going to be affecting older people, it's going to be affecting younger people, like I gave you the 2 examples. And if we do not have a uniform policy, for example, California just mandated yesterday that kids that are going back to school will be wearing masks. LA, you go out to a restaurant, you have to have a mask. You have to have these because schools, businesses, arenas, football stadiums are what we call super spreaders. So if you're going to try to have this new norm where you're having concentration of people, you're going to have policies and procedures that can affect and treat and maintain the virus by having good protocols and procedures for your establishment, a school, bank, whatever. You have to do that. If not, we're never, ever going to get a hold of this virus, and this virus is going to drive the pandemic for another 50 years.
Well, we know it is hard to keep up with. Dr. Lane Rowland, thank you so much for always bringing in your advice. We appreciate your time.
Thank you very much, and your staff and everybody at BNC. Shout out Super Sunday night. You guys take care. I'll see you guys next week.
You too.